A good friend of mine, Marcia Neal. She's a senior agent. Vibrant USA. Let me see here. Are you, let's see, 2005. 18?
18 years
18
August.
years?
Yeah.
Yeah. Hey, listen, the host can add. How about that?
That's great.
It is a company that specializes in Medicare and individual health insurance plans. Good to see you. We have, it seems like we've become a world where everything is happening on the internet. I know I can't get by without it. Sometimes I wish I could.
Yeah.
Because, you got to believe everything on the internet because it's all true. They can't put it on the internet.
Some people believe that, unfortunately.
If it's not true. Is that the same with Vibrant USA? Not that it's not on the internet, not true, but you guys are really involved with stuff like that, right?
Well, in this day and age, more and more people are becoming really computer savvy.
Yeah.
And this is good since more and more business is now conducted online. However, there are times when personal service far outweighs the convenience of computers. Mm-hmm. And for a lot of folks, Medicare insurance is one of those areas. So today, one of the things I want to talk to you guys about is how Vibrant USA can help you. What can our licensed agents do that you may not be able to do on your own?
I was just thinking, we usually jump right into questions, but I don't know if we've actually taken a couple of minutes to tell everybody, who Vibrant USA is and what about the insurance plans that you guys might offer.
Oh, okay. Well, Vibrant USA is a good question. Vibrant USA is an insurance broker. There is no Vibrant plan. Mm-hmm. As a broker in Washington, we represent over 50 insurance plans from different companies. Therefore, we are looking out for your best interest since we are not bound to any one company or one plan. Mm-hmm. Yeah. Can
you give me some examples of how you help people?
Sure. Okay. So when it comes time to purchase a Medicare insurance plan, you can go online or you can go to a licensed insurance agent like our agents at Vibrant USA. Online, you will get some fast answers, and depending on your expertise, you may be able to get some of your more in-depth questions answered, providing you know the right questions to ask. With Vibrant USA licensed agents, you will also get fast answers, and you will be prompted to think about your individual situation, because really there is no one right plan for everyone. We all have different wants, needs, budgets, etc.
Yeah. So if they get with an agent, what are they going to talk to them about?
Okay, great. So Vibrant USA, for example, our agents would talk to somebody about like how many prescription drugs do you take? Are they generic? Are they brand names? Do you currently have a drug plan? Mm-hmm. Will you consider mail order? Or do you prefer to go to a local pharmacy? Right? Are you covered by a company plan? And if so, do you have dependents covered on that plan? Do you know what happens to your company plan once you turn 65? Are you willing to pay co-pays and co-insurance in exchange for a reduced premium? Mm-hmm. Or do you want all medical expenses covered?
Yeah.
Do you qualify for some assistance, extra assistance for low income? Mm-hmm. Do you travel? Are you a snowbird or do you travel abroad? Who's your primary care doctor? Are you willing to change doctors? And who are your specialists? What hospitals do you prefer? These are all the kind of questions. Yeah. Do you understand what Medicare does and does not cover? If you will soon be eligible for Medicare, are you? If you're eligible for Medicare or you're older and finally leaving your employer coverage, do you know what steps to take to get enrolled into Medicare? So and then if that happens, what happens to your dependents if you go on Medicare? If you have higher income, do you understand how that can affect your Medicare premiums? And not only this year, but years to come.
I'm thinking most people who talk to you won't know the answers to these questions. That's why you have your agents.
Exactly. Yeah. So these are just some of them. And then we help them to try to, understand their options. And then we go over the cost and benefits. And if they decide to purchase a plan, Vibrant USA will continue to be there to assist them throughout the year.
Oh, so you got a great support crew there.
Exactly. So there's things that happen like a claim isn't paid and you're getting nowhere with the insurance company. Vibrant USA can usually help with something like that. You suddenly need a new specialist. Who can you go to? Your insurance plan decides to leave the market. This can happen. What choices do you have? There are changes coming up in the Medicare regulations, and what does that mean to you? And is the plan you selected this year good year after year?
Yeah, Medicare changes, their guidelines a lot.
Right.
So you guys help us who are on Medicare, kind of keep up with that.
Constantly changing. Yeah. It's an ongoing thing nowadays. Yeah. It's every year.
That is, well, I tell you, every time you come in here, you give me good info, but my brain hurts because that's an immense amount of things to consider.
It really is. And unless you really enjoy reading, and there are some really good resources out there, you may not find the plans that will work best for your needs. And so at Vibrant USA, we specialize in insurance products related to Medicare. We know the questions and we have the answers.
Oh, okay. But what if I'm totally self-sufficient. I like to read. I love the internet. And I especially love the Medicare Advantage commercials. It promises me a new house and a trip to Vegas every year. And I want to do it all on my own. What if I want to do my own research?
You know, a lot of people are like that. And I totally get it. So there are a lot of good, there's a lot of good information on Medicare.gov on their website, or you can visit our website, VibrantUSA.com, and you can learn how Medicare works, how the different types of plans work with Medicare. And when you have done your research and you've checked in, just come back to us for those specific questions that pertain to you, and let us show you the plans you're most interested in.
Oh, okay. Full disclosure here, Marcia helps me a lot, especially with my prescription plan. Now, everybody knows what has happened to me over the last couple of months.
Oh, do they? Okay.
Oh, yeah. We finally. I was off the air for like 2 months. Everybody said, "Where's Bill?" Let's see. Went into AFib. Went. So I had an aneurysm right after that. Then they found out all my arteries are blocked. So they said we got to do bypass. So I've had a rough couple of months. And they had me on a lot of different prescription medication, which I, had never counted on because I didn't think this was going to happen. So I'm on a different RX plan, and you were telling me before we went on the air that if I'm going to have some certain medications going forward, I think you said it's the fall that I can kind of start looking at different plans if I wanted to change.
Exactly. So everybody during the annual enrollment period, I highly recommend they look at their drug plans and make sure that they're on the right plan for the next year.
And by the way, there's a lot of them, so that's why we have you.
This year's 24 of them on the market. So so a lot to choose from, but it all depends on your medications, which of those plans work best for you. And so that's what we help people do year to year.
Well, what I tell everybody is the last 2 months, I put it in a capsulized version. I say, I almost died, but I didn't. They did tell me on the aneurysm, I had like 3 or 4 hours to get to a table and fix the aneurysm, or I would have bled out totally.
Pretty scary stuff. Yeah.
But here I am. I'm still here, kicking. I love Medicare, by the way.
Life is crazy.
By the way, I'm starting to get my EOB explanation of benefits in from Medicare and from. I have no idea what this is going to end up skyrocketing to, but I'm sure. When this is all over, the procedures and everything I went through, they're going to run into the hundreds and hundreds of thousands of dollars, wouldn't you think?
Yeah, and your supplement's going to do a really good job for you.
My supplement's taking care of the other 20%, which I always encourage everybody. If you're on Medicare, fine, get a good supplement. Yeah. So anything else we need to chat about, or our listeners need to know about? Yeah,
just real quick, I just want to kind of touch on the fact that the COVID as a pandemic officially ended on May 11th. So although we know COVID isn't gone, it will now be treated as any other medical health issue under the health insurance plans. So with the vaccine covered as any other flu vaccine. So it used to be they covered really, really well anything related to COVID. That is done. If you go in because you have COVID to the hospital, they're going to treat it just like any other health issue that you might have. And so you're going to have more out-of-pocket costs going forward.
Okay, so you got to. That's a good reminder. You got to be aware of that. Webinars, still doing those?
Yeah, we are. We are holding the live webinars where anyone new to Medicare or folks already on Medicare and wanting to review how it all works can attend a virtual seminar twice a month. One at 10 o'clock and one at 5:30, hoping to find, again, a time that will fit with everybody's schedules. We not only explain how Medicare works and the variety of plan options you have to go with your Medicare, but we answer questions about when and how to enroll into Medicare Part A and B, and what happens if you're still working. So folks can contact us to get our webinar schedule and reserve a spot.
A sea of information to wade through, and that's why you are here. If they want to get hold of you, Vibrant USA, what's the best way?
Oh, perfect. So they can give us a call at our toll-free number, 866-733-5111. They can go to our website, VibrantUSA.com, or they can find us on Facebook.
Can you do me a favor? Come back a couple of weeks and we'll talk about what's coming up later in the summer and maybe the fall as well.
I would love to. I think we have some events coming up too later this summer.
Some good social events. Yeah. COVID bye-bye in the car. That's nice. Marcia Neal, Vibrant USA. Always good seeing you, my dear.
Thanks, Bill.